Hi everyone, how you doing? My name's Gus. I'm a cosmetic and implant dentist based in Marlow in the UK, and today I want to talk about my all-on-4 procedure and what we're doing to really dramatically cut down the number of appointments. You see, the problem that I'm having, which is a good one, is that some of my patients are actually traveling a really long distance to come and see us to have this treatment done. And although I get inquiries, from all around the world, 99% of the time my response is find someone local for this treatment, okay? And I honestly think that this is a really good piece of advice, because the truth is complications happen, temporaries can break, and it's really frustrating when something like this happens and I'm not nearby, and it's a long 2-3 hour journey for my patients to come and see us. Now, complications is one thing, all right? It probably happens in about 10% of cases, and they're not severe things. They're often quite little things which are easy to fix. But they do happen, and they're inconvenient. And the other side of the story is once we've had the treatment, the second stage of the treatment, i.e. making the final set of teeth, quite often needs 3, 4, 5, 6 much shorter appointments. And I always feel it's really, I don't feel good that my patients are traveling 2-3 hours to come and see me for a 45-minute appointment. Okay, so I'm going to show you things that we're doing to really cut this treatment time down. Although it's called things like teeth in a day, the treatment is never carried out in one day. You see, first of all, we have our diagnostic appointments. We take our CT scans, any digital scans, we record the bite in this session. Sometimes we need 2 sessions to do this. And then we have everything we need in order to do the surgery. So the surgery is done in one day. Okay, 1 session with anesthetics. The bad teeth are out, implants go in, and we try and fix the teeth onto the implants in that one day. Okay, so that's why it's called teeth in a day. All the messy stuff is really done in one day. But then 2 weeks later, we'll have a suture removal and a review appointment. Okay, so quite often the stitches that I use don't dissolve by themselves, so they need to be removed. So we take them out and we make sure everything's healing nicely, and we understand how our patient got on in that first week. Then we just let the implants heal, okay? And usually 3-4 months is about the correct time for this. The implants actually heal much earlier, but we want the gums to kind of change shape and come to their final kind of resting position. Then once we've done that, we take impressions, molds for the first time. Then we come around and we almost do it the second time, because we need to check that our first impression was really, really accurate. Then we have try-in appointments where we try in what the smile is going to look like with teeth which are just sitting in wax. This is often not correct the first time. Things like the midline are off, or the smile is canted left and right. All this kind of stuff needs to be corrected and adjusted, so we have multiple try-in appointments to make sure that everything looks good. Then once the patient is happy with the look, I'm happy with the look, and we're happy with the way teeth are biting together, we'll have the thing processed and the finals made. So there's quite a lot of appointments which are kind of almost in the control of my lab technician, and all my lab technician is working from is photos and records which I'm giving them. Now, I thought there's probably a better way of doing this, and we're utilizing new technologies in order to help us do this. So we've still got our diagnostic appointments where we take our initial records, we put our implants in, that stuff all happens as normal. But what I'm doing now is taking a digital impression on the day that we do the treatment. Now, with these digital scanners, I was a little bit cautious initially, because I thought, there's no way as accurate as the messy impressions. I know they're much more comfortable for the patient to have a digital scan than an impression, but it's all about the accuracy and the end result for me. Okay, but after trying it out quite a lot, I've actually realized they are pretty accurate. So the other advantage is, because there's none of that messy gooey stuff, we can do it on the day of the surgery, on the day we put the implants in, which is quite neat. So that's our kind of initial impression done. Now there's a stage where we put a fit checker on the implants. So we take this digital impression, we have it 3D printed, and the lab will then make almost like a jig. They'll connect components which should in theory sit perfectly on the implants. If they do, that means our digital impression was accurate. Now, this stage often it is accurate, and it's a fit check. It's a checkbox experiment. I think in the last 2 years I've had one where it didn't fit properly, so we had to retake the impression. But either way, it's an essential part of the treatment, and it only takes 10-15 minutes to do. So what I've started doing now is almost build a trial smile on this fit checker. Okay, so when the patient comes in after 2 weeks, we're now able to, instead of having a 15-minute appointment to just take out stitches, see how things are going, we have a much longer appointment where we do our fit checker and we have a trial smile. So here's a photo of what I mean. And this thing, when we fit it in, it's a copy of the initial kind of wax try-in that the lab has made, and you can see that the back teeth are too long. There's a gap between the top and the bottom teeth. The front teeth are too short. We've got this reverse smile line. What you can't see is that the teeth are too far forward as well, and also this lady has a very small mouth. It's not immediately obvious when you're looking at this, but these teeth just looked too big for this lady. Now, it's very difficult to communicate these tiny details to the lab. So what I did here, I just adjusted this whole trial smile with hand pieces, and I just crafted what I thought the perfect smile should look like in the patient's mouth. And this took about half an hour, 40 minutes, something like that. And I was able to record the bite with a lot of accuracy as well. Now, what this means is the lab, I can just send this to the lab, and the lab have a really accurate model to copy. Okay, I'm not saying to them, oh yeah, move this tooth up by 2 millimeters, move it in by 1 millimeter, or anything like that. There's no guesswork. It takes a lot of the guesswork out of it. And then the theory is next time the try-in that we have, it's spot on. Okay, we still have a try-in. I haven't got enough faith in the system to go straight to finish as yet, but we have this try-in, we know it's fitting well, and we've cut out about 3, 4, 5 appointments to get to this stage. And this, I should have thought of this sooner, to be honest, because this is exactly the same process that we use when we do a full mouth of veneers. We craft everything in the temporary materials first. It's just that when we're doing dentures, we tend not to use this process. So the multiple try-ins in wax comes from a denture kind of process. But we've just modified it to fit with full arch implants, and it really helps out those patients who are traveling quite a long distance. So anything that we can do to kind of streamline the process, we're doing it. And with digital impressions, it really does help us out, and it's got a massive convenience factor. So I think the point of this video isn't to be an advert, hey look, come to me, because 99% of people who watch these videos are too far away, and I would still say find somebody local. Okay, it's always better to find someone local to do these kind of treatments for you, but it's to highlight that not everybody does it in exactly the same way. There's so many ways to do this kind of treatment. The surgical stuff is pretty much, you know, there's a well accepted way of doing it, and most experienced surgeons will be doing it in that way. But when it comes to the final smile design and the look, which, to be honest, as a patient, that's all you can see. That's how you're judging the whole smile. There are a number of ways of doing this, and even though I've described one way, your own dentist may have another way, and they may be getting fantastic results. Okay, so I hope you found this video useful in some way or another. If you did, you know, give it a thumbs up, share it with your friends, you know, all that kind of stuff. It helps more people see it, and it's just quite nice. Okay guys, until next time, take care.